First of all, I am Luciana, and it feels really emotional to be here because I was here 7 years ago. And I was in a very different place. My daughter was in a very different place. So thank you for this community, and thank you for working so hard to keep our kids well. Okay, so is it this one? Yeah. So this is Beatrice, and she has her bone cake, so 6 years after BMT. Yeah, she's away from me. She's studying in California. So she was diagnosed in 2013. I'm not going like a lot into her story because I've told before. So I want to give like a little bit of the BMT perspective about the criteria and other things. But she was a very refractory patient or difficult to treat. And she had quite a few episodes of MIS, liver reaction, lung disease, and then it evolved very fast to pulmonary hypertension in her case. We were living in Switzerland, so the BMT was made in Switzerland. She had some bumps, but bumps are normal in BMT. And yeah, she's doing great. She's in remission, just calcium, vitamin D, and birth control pills. Because she's an adult now, so yeah, birth control pills. Yeah, and she used all the meds that are here, and she is really in complete remission. And since then, since 2018, I'm in the Facebook group, and I've been talking to the parents who are being evaluated for BMT. So we are like a really close community. So whenever someone is talking about BMT, Leah tags me or Hashmi tags me, and then we are close to these parents. And there are like lots of things when you make a decision to go to a BMT, and it should be a shared decision because BMT is not easy. Even when it goes well, it's not easy. It's not an easy treatment. So we did this decision. For us, back in 2018, it felt like we had no other choice because there were no JAKs, but we have JAKs now. So, and now, where do you decide to do the evaluation for a BMT? What we are seeing is that different centers are making this in different times. Like some centers are trying JAKs, some others are not. Some countries, we do have IL-1, in others, we don't. So it can be tricky. What we used to say is that being evaluated for BMT doesn't hurt. It's not that I'm saying that everyone should be or that I'm defending, no, but it's another treatment option for the difficult to treat patients. Yeah, and we didn't have a 10 out of 10 match. It was a 9 out of 10 match. And she was also positive for the HLA-DRB 1*15. So, and that's why we decide. And we are kind of seeing also these patients, some are positive, some are not, some in Europe, some are having like a drop in chimerism, but it's still in remission. Some have high chimerism and are not in remission. So yeah, so it's really very diverse. So I would like to start this is Pierre Cartier, all of you know this paper. And then here we can see that in his recent approach, he's kind of mentioning BMT in almost all the phenotypes, all the different patients. Okay. And okay, so last, that's what I told like at least 9 BMT. So I know like 2 in England, 1 more in Switzerland, a couple in Cincinnati, some in California. So that's the patients we have been talking to. All of them, I think they had MIS episodes. And, but what we are thinking is that before it was just the lung disease patients, and now we are kind of seeing patients with other phenotypes, like the persistent arthritis and also the patients with the GI issues. So as a parent, can we have a kind of a algorithm or can we know when is our window of opportunity to go for a BMT? Because if like the damage is too far, then we cannot go. Even for us, so Beatrice had pulmonary hypertension. She had to do a catheterization 1 week before BMT. So if it was like a high pulmonary hypertension, then it was a no-go, but it was a mild one. But then you have all these emotions there, right? Like 1 week before BMT, and maybe it's a no-go, and then just treated with dexamethasone. So, yeah. So with that, this is my question. Is it possible to have an algorithm or protocol for BMT evaluation in SJIA, MIS in refractory cases? Thank you.